Hello everyone, I'm Shaquanda and I will be informing you on kidney failure. Kidney failure is when the body can no longer rid waste. There are two different types, acute and chronic. With acute renal failure and chronic, the doctor can look at lab values or do a renal ultrasound. With lab values, they will monitor your BUN, your creatinine, and your glomerular filtration rate. Your GFR is known as your glomerular filtration rate, and when you're in renal failure, that usually decreases, while your BUN and your creatinine actually increases. Acute renal failure can simply be caused by new medication or not taking in enough fluids. And treatment for acute is sometimes usually just IV fluids. That's when the doctor can put you on normal saline, lactated ringles, or half normal, depending on the doctor's preference and the patient history. And also stopping that particular medication that could have caused that renal failure. Chronic kidney disease have 5 stages. Once you hit stage 5, you now need dialysis. Hemodialysis can also be used for acute to help jumpstart the kidneys. Dialysis is just filtration of the blood. The hemodialysis machine and also the peritoneal dialysis machine is a man-made machine that acts as a kidney. It's actually just a kidney. It does exactly what the kidney is supposed to do. It just filters. Hemodialysis access could be either a temporary cath, a tunnel cath, a dialysis graft, or a dialysis fistula. A fistula is when you directly connect a vein in an artery to itself. Which, when you use a graft, that's when you take a man-made tube to connect the two. Usually you have to do that when someone has real weak veins and arteries. So to prevent having those problems trying to get a fistula, they just go ahead and do a graft. With a tunnel cath, it's more permanent than a temp. A tunnel cath is used most often when someone is getting a fistula, because you cannot just get a fistula today and then start using it tomorrow. A fistula has to mature, and it can take from 2 to 6 months. When you're on dialysis, each day the doctor may look at different lab values that you go to dialysis to see what kind of dialysate is needed. If your potassium is low or if your phosphorus is low, they can actually give you a run of that with your dialysis. Dialysis is usually done on a weekly schedule, either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. You're there up to 4 hours each day. It can be very tiresome and very exhausting. Some people do prefer peritoneal dialysis, but not everyone qualifies. It's up to the doctor and the patient. With peritoneal dialysis, you have to be very, very careful about infection at the site, because you're at home and you're doing it yourself. They have someone on call that can come out and help you, but 90% of the time with peritoneal dialysis, that patient is doing it themselves. Renal failure can be prevented real easily and treated real easily if caught in a timely manner. It's always good to follow up with your doctor on a regular, drink plenty of fluids, and listen to any education that's given you. Dialysis is very harsh. It is manageable, but it can be very, very harsh on your body, and it's tiresome, and not everybody is up to being somewhere 3 days a week for 4 hours at a time and being sick afterwards. Some people do good on it and some don't. It just depends on the patient and that particular person. So listen to your doctors, follow up as needed, and always remember to drink plenty of fluids.